Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we hear about a new study that could significantly change our response to diabetes. We're all too familiar with the crippling effects of diabetes. Hundreds of Barbadians have either lost limbs or suffered serious damage to vital organs, including the kidneys, the eye, and the nerves. In fact, 80% of our population is living with type 2 diabetes, and it's crippling more young people. According to Dr. Karen Bino, that's in a region where 1 in every 5 people will die because of diabetes, despite the fact that millions are spent every year to treat the non-communicable disease.
So when we actually look at the figures, approximately $750 million it was estimated is spent per year in the Caribbean on diabetes care. And that was in 4 countries: Trinidad, Barbados, Bahamas, and Jamaica.
She's also concerned that more than half of all diabetic patients will use insulin within 10 years of diagnosis, though the disease could be reversed before it reaches that stage by simple lifestyle changes. In short, Barbadians can beat diabetes. Last week, 25 diabetics embarked on the Barbados Diabetes Reversal Study to prove just that. The study mirrors a diabetes research trial conducted in Britain by Professor Roy Taylor at the Newcastle University among 11 persons between 35 and 65, which showed that type 2 diabetes can be reversed by adopting a short, low-calorie diet followed by good weight management.
They were on an 8-week very low-calorie diet, 600 kilocalories per day, with 45 shakes and non-starchy vegetables. And after 8 weeks, their blood sugar levels returned to normal. They had a reduction in fat in the pancreas and the liver, and this was evaluated using MRI scans. And that liver fat returned to levels which were normal, which were similar to persons who did not have diabetes. And they also had improved insulin production, as we spoke about. And then 3 months after the diet, up to 3 months after the diet, 7 out of 10 people were diabetes-free.
In the Barbados study, the 25 participants ages 20 to 70 years will be similarly tested over 8 months.
So we're using 4 certain shakes per day, as well as non-starchy vegetables. What are these? So these are vegetables such as kale, broccoli, your lettuce, your green leafy vegetables. You can use beets, carrots, and so on. And essentially, the participants are only allowed to have half a cup of these vegetables if they're cooked. You can blend the vegetables, and you can have 1 cup of raw vegetables. And we've actually prepared nice recipes for the participants and different herbal blends to spice things up a little bit, because we know it can be challenging. So they're low, that's what they're low. 3 servings of the vegetables and 4 glucernic shakes only. Nothing else. No meat, no fish, no poultry, no bread, no pasta, no potato, no sweet potato, no beans, no peas, no alcohol, no fruits, no dressings and margarine and so on.
The investigators are hoping to find out if the low-calories diet can work in the Caribbean and its effect on diabetes. They will also be monitoring to see if diabetes can be reversed and if this can be maintained for 6 months after the study is completed. Dr. Bino, who's the clinical investigator of the study, is anticipating positive outcomes, which could lead to a new approach to tackling the high incidence of diabetes.
We expect that we will get approximately a 30-pound weight loss, which is about 5 pounds per week, over the 8 weeks. And we expect the diabetes to reverse, meaning you get normal blood glucose levels, both fasting and postprandial, as well as improved insulin secretion. We expect that you will also get reduced blood pressure because you're losing the weight, so some persons may even be able to come off of medication. We expect general health, improved general health as well because of your weight loss. So automatically your risk factors are reduced as well, and the likelihood of complications from diabetes.
We anxiously await the findings.